Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our discussions and our conversations around the COVID-19 pandemic, and we are now in the third week of April 2021. And as we're speaking, we have over 11,000 gynaes testing positive for COVID-19. And unfortunately, we have recorded over 270 deaths attributed to COVID-19 infection. We will continue these conversations while I take my mask off. Remember to wear your masks to cover both your nose and mouth. I'm going to take it off and keep it off for the remaining conversation that we're going to have today, because there's no one close to me, at least not within 6 feet. So I'm not putting anyone at risk, and they're not putting me at risk. If you have any questions or comments regarding COVID-19 pandemic, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. And you can send questions or comments about anything related to COVID-19. You know, by now we would have been approaching 100,000 doses of vaccines given to our residents or persons living or citizens in Guyana. And that's a remarkable achievement, having started just over a month ago. I was lucky enough to be one of the first people to get vaccines because of my frontline healthcare worker status. And several of my colleagues, in fact a lot of them, would have taken the vaccines as well. We're all doing pretty well these days, and even though some of us may have had some initial reactions, which include some fever, chills, pains, body aches, etc., these were all mild and did not last for long. They were treated very simply by taking Panadol or Tylenol or paracetamol. These are the common names for the same medication. So just to let you know, everyone in the medical field that has taken this vaccine, you know, they still remain well and continue to serve the people of Guyana to the best of their abilities. Now, a particular question has been recurring, not just by sending in these thoughts from our audience or viewers and listeners, but just interacting in the community by meeting people at work, by meeting people, you know, in the supermarket, etc. People have called, and the questions they are asking relate primarily to vaccine safety and pregnancy. And people want to know if the vaccines are safe to be given in pregnancy, or if they're safe to be given to a breastfeeding mother. Those are extremely important questions, and they deserve to have a frank, open, and honest discussion so that we can arrive at the best answer for patients. It is something that will be on a lot of people's minds, and people can become worried, especially when the potential life of an unborn child is being called into question. So today we're going to spend some time to discuss this topic, and hopefully by the end of it you would become clearer as to what the answer is. Should you take vaccines if you are pregnant? Now, a number of persons would have taken vaccines and not know that they're pregnant. So we do not want to have a situation where you recommend that every woman of childbearing age take a pregnancy test before they go and get a vaccine. That is not a practical recommendation, and it's not going to happen. So by just pure statistics, one would be fairly comfortable in assuming that across the world, a large number of women would have taken the COVID-19 vaccines not knowing if they're pregnant, and quite a number of them might have been pregnant. There has been no subsequent upsurge in miscarriages, and there has been no subsequent delivery of abnormal numbers of abnormal babies. So that is one thing to bear in mind, that women who were pregnant did take the vaccine not knowing that they were pregnant, and subsequent to taking the vaccine, we have not seen an increase in the number of miscarriages, and we have not seen an increase in the numbers of abnormal births. So that's an important thing to know. So the big question is, should women who are pregnant take the vaccine? And that is a question that we will attempt to answer today. But before we answer that question, let us look at what happens to hospitalized women who are pregnant and have COVID-19. How do these patients fare? About half of hospitalized pregnant women with COVID-19 had symptoms. And if you recall, the majority of people with COVID-19 do not have symptoms. But here in this particular group of pregnant women, half of them would have some kind of symptoms. Some hospitalized pregnant women who had symptoms actually had very bad or severe outcomes. And when we talk about bad or severe outcomes related to COVID, we're talking about three main outcomes. One, admission to the ICU, which in itself has its own problems. Two, the need for mechanical ventilation or support ventilation during this admission. And the the third bad outcome that we measure for and we look for is, of course, death. And this, when we have pregnant women who are positive or who are suffering from COVID, unfortunately, there is an increase in the number of ICU admissions. There's an increase in the number of mechanical ventilations, as well as the number of deaths. With that in mind, then the decision about whether or not to take the COVID-19 vaccine may become somewhat easier, because we know what happens to pregnant women who get infected with COVID-19. Their outcomes are worse than women who do not have COVID-19 and are pregnant. And so if we look at the safety outcomes of patients who have taken the vaccine versus what happens in a background number. So we look at pregnancy safety of vaccines in the COVID-19 era. And we look at data as it stood at February 2021. Pregnancy outcomes that we look at for miscarriages, normally without COVID vaccines, etc., pregnancy miscarriages before 20 weeks stands at about 26% of all pregnancies, and stillbirths about 0.6%. In the group of women who actually took vaccine, the miscarriage rate was actually 15%. That's 15% compared to 26% in a normal background rate. When you look at complications of pregnancy, the biggest ones that we concern ourselves about is gestational diabetes or diabetes associated with pregnancy. Normal background rates is between 7 to 14%. In the vaccinated population of pregnant women, the incidence of gestational diabetes was 10%. Preeclampsia, which is high blood pressure syndrome in pregnancy, occurred in between 10 to 15% of normal pregnant population, regardless of COVID. In an era of COVID vaccine, preeclampsia was about 15%. If you look at the next big category of preterm births, in the background incidence without COVID, there is a 10.1% incidence of this happening. That is preterm birth, babies born before time. For women who receive the COVID-19 vaccine, the number is the same. For abnormalities in the infant after he or she is born, there's a background incidence of 3%, and in the vaccinated group, it was 4%. For neonatal death, that is death just after birth, in a background incidence, this occurs in about 0.38% of the time, and in the vaccinated group of women, this occurred in 0%. So overall, there is really no significant difference in the vaccinated group of pregnant women versus normal pregnancy before the era of COVID-19. And that is true when you look at all of the major indicators, things like miscarriages, the development of diabetes during pregnancy, hypertension during pregnancy, preterm labor, as well as birth abnormalities. And so that tells us that if you compare those two groups, vaccinated pregnant women versus non-vaccinated pregnant women, there is no difference in outcomes of their pregnancy. And that's important to know because it helps somewhat to alleviate the fears that people may have about vaccine safety during pregnancy. So there are about, in the US, there are about 4 million births per year. And we do, of course, need to have formal clinical trials that look specifically at pregnant women related to vaccines. And we're talking about the COVID-19 vaccine. The American College of Gynecology recommends that vaccines should not be withheld from pregnant individuals who meet the criteria for vaccination based on the priority groups. And let me explain that a little bit. What are the priority groups? Priority groups, we started out with healthcare workers, frontline workers, all persons who essentially fall under the category of essential workers. These are considered to be priority groups. So if we have a pregnant nurse, for example, a pregnant doctor, a pregnant hospital employee who is absolutely necessary for the smooth functioning of the hospital, the authorities have recommended that that person should be offered the vaccine just like any other person in a high-risk environment. Being pregnant does not prevent these patients and these women from being offered the vaccine. And of course, everyone has a choice whether or not they will take the vaccine. So hopefully this would have shed some light and encouraged some people to be a little braver and have more confidence in taking their COVID-19 vaccine, whether or not they're pregnant or suspected to be pregnant. If you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thanks for watching and listening.